on the spot, Dr. Cooper. Can you explain why there is anemia related to some of these ADCs? And then do you think overall that there's less side effects or fewer side effects with ADCs compared to our traditional therapies?
Yeah, thanks for those questions. I probably should have included more of this in the talk. So ADCs, although a new class of drug, as you saw in the talk, they're really kind of just like a dressed up chemotherapy. So they are still very similar to chemotherapy in terms of side effects. And one of those can be low blood counts, including anemia or hemoglobin, but also white blood cells and platelets too. It's a pretty common side effect actually across ADCs because, as I had mentioned, those warhead or sort of payload molecules are very potent chemotherapies, strong chemotherapies, and so they do still have that chemotherapy effect on damaging cells that divide quickly, like those in the bone marrow that create the blood cells. I think it's important that I emphasize that ADCs do not have fewer side effects actually than other drugs and may actually even have more or potentially at least different side effects than the therapies that we're currently using. For example, datopotamab deruxtecan and trastuzumab deruxtecan, a lot of those ones with the deruxtecan at the end of it, ifinatamab deruxtecan, patritumab deruxtecan, they all have that suffix. Those drugs can affect the eyes. They can have some eye toxicity. They can have some what we call stomatitis, which is sort of like mouth sores or sort of irritation of the mucous membranes of the mouth. Can also have some lung toxicity like interstitial lung disease, which is sort of like inflammation of the lungs that can cause trouble breathing. All of those side effects are very important to watch out for. And while not super common, can be serious. And so just to emphasize that although the side effects are different than other drugs that we use, they are certainly not less, unfortunately.
I agree. I think that's a critical point to make.